Good afternoon, I'm Mabel Jong here at the World Healthcare Congress, and we're winding up our first day of the event, and I'm so pleased to have as my last interview of the day, Dr. Gifford, the Chief Executive of Providence-Swedish Health Alliance. Dr. Joe Gifford, thank you so much for being here.
Thank you, nice to be here.
Well, tell me, you've just finished a panel. What were some of the key takeaways that you left folks with in the audience?
The questions were a lot about how to get started in accountable care and what the journey's been like with accountable care. So we had representation from Care First, a health plan, Memorial Hermann, a big delivery system, and then ourselves, Providence Health Systems. And I think the biggest learning is that it's very difficult and it's time to get started. I think we all spoke about the voyage of getting started and how information systems and engagement and culture and all those factors are essential. And I think we all told stories, sort of war stories, of how we have tripped a bit along the way and where we see the horizons to be. But there was consensus that it's a journey that we've all committed to fully, and that it's really just time to get going.
Now, what were some of the little trips that you had to make through Providence-Swedish, and how did you pick yourself up from that?
Well, there are many ways to look at that. I think the biggest problem to talk about is the IT problem. If you want to talk, if you want to talk about stuff that doesn't work well, I think IT is probably the hardest one right now. As you get bigger and you try to innovate over scale, what you learn is that there are so many disparate systems, so many data sources, claims data, pharmacy data, behavioral health data, EMR data, Epic data, all that stuff coming in. And you're trying to provide information to clinicians that's actually actionable, so they can actually move the needle and change the way they're doing things. That it is quite a problem to get everything into one place, organized, presented in a way that's meaningful. So I think that I would say that's a hurdle that's worth really looking hard at now.
Are your customers growing with you? Have you found that there is the patience to kind of work things through the IT questions, and also are you being able to communicate with customers well as you do this, as you go through your growing pains?
Yeah, that's been a good one. So the Boeing arrangement has been very interesting on that front. When we first engaged with Boeing, we were, I'll just say, asserting a lot of qualities that were perhaps a bit aspirational, and or we knew a path, and we were saying we're going to get there. And the voyage has been about 2 years with Boeing, and in that time we've been so deeply involved with them that we've gotten to a point where they completely understand. It's like their folks have actually been our employees for 2 years now, and they completely know our world, and we know their benefits world. We don't know about airplanes, but we know the world of their benefits. So there's just what you say, there's a lot of forgiveness now. There's a lot of just, they say, how do you think you could get this done with a roadmap that makes sense? Not can you get that stuff done by next June, but paint the picture of how you can get that to work over the next year or two. And if you give us the milestones and tell us how we can get this done together, then we're on this voyage together. So we're seeing a lot of that.
So there's definitely a lot of collaboration and assistance on both sides to get this going right in the right direction.
I think so.
Yeah. What do you think the next stage of development will be? Where do we go to from here?
From here, I think we're going to see more progress along the lines of complete engagement of entire systems. I think the Secretary Burwell recently announced the huge commitment to making Medicare payments go through value-based models. And I think that has triggered a sense that this really is the future. And I think any kind of straggling holdouts around hoping that it all go away have now come to see that this is where it's going. So I think we'll just see a lot of refinements of a model. So it's not like there's going to be a giant change into a different direction. I think this value-based care is the direction, but I think what you'll see is refinements, just iterations on it, refinements in the type of data, the type of complicated financing that goes on. So I think we're going to see iterations in the model as we go forward, and everybody gets all in.
Okay, Dr. Gifford, thanks for stopping by. We really appreciate it.
My pleasure. Thank you.
And Mabel Jong, thanks for watching and sticking with us.